If you've recently discovered that you've injured your ACL, possibly through a complete rupture, your first question is most likely to be, do I need surgery? In this video, I'll be going through whether you do require surgery or whether there are other options such as conservative management that you can go through instead. Surgery is often considered as the default option. I'm here to present to you a couple of other options that may be better for you. I'm also going to be breaking down why females have a higher incidence rate of ACL injury compared to their male counterparts. Making a decision about your ACL should never be rushed. You should always consider different people to include in the conversation, such as your physio, your surgeon, your family, and any part of your support network. It's important to know that ACLs have been shown to heal in some cases. However, it's also poignant to understand that under medical review, you can still get about your day-to-day life with a partially injured ACL, meaning surgery is not always the only suitable option. There are alternative pathways that can be considered. Firstly, conservative management, which is where you'll be following an exercise-based rehab program for up to 12 months. That's one way. A second way is cross-bracing protocol. This is quite a new piece of evidence. However, some people are seeing excellent optimizing factors in coming back from an ACL injury. When considering what's best, for example, surgery, conservative management, or the cross-bracing protocol, there are a range of things to consider. For example, your age, your gender, your occupation, the sporting demands, and external symptoms, such as not only just injuring the ACL, whether you've had any MCL, LCL, or meniscal damage. These are all things to consider as a whole host of things, whether you're supposed to get what type of management outcome. In fact, the timeframes for all of these options are actually very similar. Surgery, 10 to 12 months before you return to your usual activities, such as sport or driving. For conservative management, exercise-based program, even though you haven't had any surgery, you still will probably have to wait around 10 to 12 months. And the cross-bracing protocol follows a very rigid structure of up to 6 weeks initially with no weight bearing through that leg at all. And again, up to 10 to 12 months of recovery before you're back to your usual activities such as sport. While ACL reconstruction is the most talked about and most researched option, new research into conservative management has shown that around 56% of patients have successful post-operative outcomes after the 2-year mark. Not only considering age, gender, occupation, lifestyle habits, other external factors such as whether you're part of a high-level sporting team, whether you play sports like rugby or football or basketball where there's a lot of contact, change of directions involved, this will be a factor as to whether you choose surgery or non-surgery. In order to get the most positive outcomes, that conversation will be discussed with your coaches, with your physio and with your surgeon. You may have to go down an accelerated pathway, which is usually the surgery option. As I said at the beginning, females are up to 2 to 8 times more likely of having an ACL injury compared to their male counterparts. This research is still in its early days. However, this is mainly believed to be down to a range of anatomical and physiological reasons. For example, females have a different angle between their hips and their knees, which may predispose them to having a more likely chance of injuring their ACLs. Another problem that females have where males don't is that they have a menstrual cycle, and the differing levels of hormones throughout their cycle can mean that their ligaments have more laxative properties than a male's static ligaments over time. So if there's more laxity in their ligaments, then they're more likely to rupture. More research is being done in this area. So if you're a female taking part in sports that require a lot of stress on the ligaments, netball, skiing, basketball, football, it's really important that you stay informed and possibly take up a ACL prehab just to really reduce your risk of getting injured. Working with a physiotherapist or a personal trainer to come up with an idea of what that looks like is what I'd suggest. The key takeaways from this video is understanding that having an ACL injury is a very complex thing to consider for long term. Whether you have a surgery or whether you have the non-surgical options such as the conservative or the cross-bracing protocol, they're massive things to consider and it should not be rushed. You should have a in-depth conversation, and it might take one appointment or it might take several appointments to come to the best outcome for yourself. If you found this helpful, go back to any point and rewind to see what you need to listen to again. And we want to wish you the best of luck with your rehab.